Great. All right. Hi, everyone. Next, we are starting a new segment with our colleague, Dr. Chris Thomson from VHS North County in California. Chris will join us to give us new insight into his work and clinical trials throughout Ethos organization and with our nonprofit Ethos Discovery. So, welcome, Chris. How are you doing out there?
Good. How are you guys doing? I heard you had both medoncs and radoncs on the last kind of segment of this. So glad to represent surgical oncology as well.
Absolutely. It's
That
all
was
part of
cool.
the plan. It's Long's
Yep.
master plan to take over the world.
Right.
So tell us about any new advances or continued work in surgical oncology and what have you been up to?
Yeah, so everything seems to be going well, same as what I'm sure they told you. We are staying busy as ever, which is always good. We do have some pretty exciting things coming up the pipes from Ethos Discovery, meaning that still continuing with our projects like we talked about before, specifically the ePush project for hemangiosarcoma. Just found out that we are now just starting our enrollment for a new clinical trial here at VSH North County that is specifically using a minimally invasive surgical technique for removal of lung metastases or
Oh, wow.
spread of cancer from the
Wow.
lungs. So a lot of exciting things coming up, and we'll be hopefully posting some blog posts to the Discovery website soon for that as well.
And so, for some of our listeners, often when we have a diagnosis of cancer, we're talking or discussing going to surgery. And one of the things that we'll do beforehand is take these, chest x rays or x
Mhm.
rays basically of their lungs to see if cancer has spread to that area. And if there is metastasis or what you sort of had just discussed, then that's sort of honestly an end game. So, this may sort of revolutionize that if there's a treatment to sort of help correct some of those metastases in the lungs.
Yeah, I think it's really interesting and it's an exciting area to be working in just because for so long, particularly in veterinary medicine, anytime we heard or saw of spread of cancer or the development of metastasis, it always seemed to carry such a poor prognosis and poor connotation as to that's it for that patient.
Right.
And on the human side, the trend has definitely changed from seeing metastasis as something that is condemning that patient to actually, this is something that you can still live with, meaning that even if a patient has metastasis and they don't jump to surgery, there's still so many things that we can do from, again, the surgical oncology side, the medical oncology side, the radiation oncology side, because it's really important for us to kind of reframe the conversation away from, this is advanced, we shouldn't necessarily do anything, to really what can we do for this pet to maintain the absolute best quality of life while they're living with cancer, because again, it doesn't necessarily matter what you die with, it matters what you die from. And so if we can really continue to maintain their great quality of life while treating these cancers in a variety of ways, I think that again, that conversation can be a little bit different, meaning that the development of metastasis is not necessarily something that stops the conversation. It really continues to evolve as we treat those patients.
So tell us about that trial. What is it? What is there a particular type of metastasis that you're working with as in the clinical trial? Is it
Yeah,
all metastasis to the lungs
yeah,
or
yeah. Good question. So the early phase of the trial is for a wide variety of different dogs with metastasis. Our main focus is for dogs with osteosarcoma,
Mhm.
and the reason for that is on the both in the dog and human disease and the data that we have, there's a very surprising benefit of surgical resection of lung metastases if it's possible, meaning that where it's feasible to remove those nodules in the patients, if they've already undergone surgery or potentially chemo for the primary disease, there's actually a massive survival benefit for those patients. One of the reasons it has historically not been commonly performed is because surgery of the lungs or thoracic surgery is always associated with a concern for high morbidity or
Right.
high pain and prolonged recovery. And now we have technologies with minimally invasive surgery where I can actually go in and remove those nodules with very tiny incisions smaller than your index finger to get those nodules out. And so those patients are acting like nothing happened within hours after a surgery like that. So if we have this ability to do this in a very minimally invasive, non-painful manner, have the potential to give them a very good outcome and quality of life, then I think that's really where we need to be pushing the science.
and are you diagnosing the metastatic disease via like a CT scan? Are you waiting for radiographic appearance
Yeah,
of them?
So most of them are initially diagnosed with radiographs. For the clinical trial, we are doing CT scans on them just because it really helps to further define exactly where the nodules are, their size, their relationship to other tissues and anatomy within the thorax. And so they're often initially diagnosed with radiographs and often from the family veterinarians. And then from there, we'll go on to the advanced imaging with the CT
Mm,
scan.
excellent. And do you have I'm obviously fascinated by this
Yeah, well,
study.
Yeah.
it's gonna change. I mean,
Yeah.
this could absolutely change the way that we practice medicine. This is extremely exciting.
So is it like, do you have a maximum number of mets that you would go in and retrieve on a particular patient? Is there a minimum size or a maximum size that you would go after?
Yeah, so that's some of the things that we're still figuring out, and
Studying, yeah.
most of that has to do with the amount of lung that we would have to resect with the tissues. So it's really on a case by case basis, meaning that we are assessing the disease burden, meaning how many nodules, how many evidence of spread there are within the lungs off of that CT scan, and then if we're able to go forward with surgery while still maintaining an appropriate or adequate amount of remaining lung volume, then that candidate will qualify for the study. And so that is really based off the CT scan and one of the goals of the CT scans prior to jumping into surgery. If a tumor is bigger than 5 centimeters within the lungs, then they don't qualify just because those patients would not be able to have the minimally invasive
Right.
option
Mhm.
for surgery. So there's a little bit of a size limitation, but it's really on a case by case basis.
And how long do you expect these trials to go on? Like, do you guys have a kind of a game plan of how it's gonna look?
Yeah, we always have a game plan and a expectation as to when we expect to start enrollment, when we expect to finish, and honestly, it's always kind of over and under for most of those cases. For this particular clinical trial, we're starting with 18 dogs, and so we are hopeful that we will get those 18 dogs in about a year and a half. But you never know, and it's always hard because the enrollment may take more time than we expect. We may also get for some of the trials, we found that we plan that it'll happen within a year's time, and it happens within 4 months, just because there's so much excitement around the clinical trial. So it's pretty variable based off of the recruitment of cases.
That's awesome. Well,
Do you
very
have any
exciting.
other things you're working on that you are excited to discuss, or is that I mean, that's enough, by
That's
the
a
way.
pretty big thing, yeah.
Yeah, I think that's the big thing, at
Yeah.
least from my side of things. That Discovery is starting to roll out a handful of additional new trials in the coming months. And so, one thing I would emphasize, especially for any veterinarians that are listening, if you want to be interested and want to refer patients for this, it's very valuable just to check out our website. It's constantly changing and evolving with what trials are open and where those trials are open, just because we have a lot of things that are definitely in development, and what's posted is really the tip of the iceberg. And so, as those trials come to fruition, they generally first get advertised on the website.
Awesome.
Right, right. Well, thank you so much for jumping on again to give us
Yeah,
little updates. I think it's really great,
yeah.
especially with how your field really kind of touches upon most of the topics that we do in these podcasts.
Yeah, I'd love to hear all the discussions about the oncology general team before. It's really great. Again, I think that the more we can get all of the specialties working together to maximize the benefit to the patient, the better. And so it's really great to hear about, again, the med onc and the rad onc side of things.
Yeah.
Thank you to our sponsor, Ethos Veterinary Health. Don't forget to rate, review, and subscribe to us on your favorite podcast platform. We also have a video version available on YouTube where you can find us at Ethos Veterinary Health.
And for updates on clinical trials at Ethos, follow us on Facebook or on our Ethos Veterinary Health and Ethos Discovery pages. Thank you so much, Dr. Thompson. Appreciate you guys coming in.
Yeah, it's good to see you guys.
All right. We'll see you guys all next time. I'm Lindsay Renzulo.
I'm Christopher Nolikin. Bye.
Bye.